Welcome, everyone, to another episode of the Invisible InCourage Show, brought to you by the Invisible Disabilities Association. I'm Wayne Cannell, founder and CEO of IDA, and I'll be your host for today's show. Our topic today is navigating the world of disability benefits from the Social Security Administration and the U.S. Administration of Veterans Affairs, or the VA, for people with invisible disabilities, with our great friends at Allsup. We are joined today by TJ Geist. Hi, TJ.
Hi, Wayne. Very good to be with you today.
And we also want to welcome Diane Winarski. Welcome, Diane.
Thank you, Wayne.
And Brett Buchanan. Thanks for joining us, Brett.
Thank you for having us.
Well, Allsup was founded by Jim Allsup over 40 years ago after working for the Social Security Administration. Allsup has helped over 400,000 people with disabilities to get the benefits they deserve and move forward with confidence. From Social Security disability insurance and ticket to work services to VA disability appeals, financial solutions, and healthcare guidance. Allsup is a national leader in disability benefits with a 97% success rate for those who complete the process with them. Now let's introduce the panelists for today. So TJ Geist is the principal advocate with Allsup, has more than 21 years experience with the company. TJ has represented Social Security disability claimants at all levels of the process and oversees the team providing representation before administrative law judges and the appeals council. Diane Winarski is a director with Allsup Employment Services and uses her 30 plus years experience in disability and managed care to oversee a team of experts helping SSDI recipients return to work using the Social Security Administration's Ticket to Work program. And finally, Brett Buchanan is the director of Allsup Veterans Appeals, a veteran himself with over 15 years of experience in representing claimants with the U.S. Administration of Veterans Affairs. Brett leads a team of specialized VA accredited claims agents in assisting veterans with the various appeals process of the VA. So let's just jump right into this, TJ. Let's start with you, and let's talk about SSDI and people living with invisible disabilities. So I've got a few questions for you. Are there any unique challenges with claims for those with invisible disabilities?
Yeah, Wayne, good question. Yeah, there are some unique challenges for individuals living with invisible disabilities. Some of the challenges that they face are consistent with other disabilities, but there are certainly some unique ones. Social Security uses a 5-step sequential evaluation process to establish a disability. And step 2 of that process is, does the claimant or does the individual have a severe medically determinable impairment? And what that means is Social Security is a medical records-based program, meaning they have to have objective evidence to establish the presence of a severe disability. And that can be a challenge with somebody with an invisible disability because unlike a back condition, you can't do an MRI that shows an invisible disability. So that could be a challenge that someone with an individual disability has to overcome. But it can be overcome. It's not something that can't be overcome. And so what that individual needs to do is to establish a longitudinal record of their symptoms and make sure that they are telling their doctors everything that they're experiencing and that the doctors are taking good records and documenting everything. It's also helpful for that individual to keep their own personal logs of the symptoms that they're experiencing, and so those are some ways to overcome those challenges. But that's the biggest challenge, I would say, with someone with an invisible disability. Something, for example, like someone who's experiencing chronic headaches. It's not, again, something that's going to show up on an MRI. So a headache log and things like that are things that people with individual disabilities can do.
Well, I think about that, when we first even launched the organization back in 1996, what's chronic fatigue? What's fibromyalgia? What are all these things? What's lupus? What's multiple sclerosis, right? And obviously, in some cases, they do have some visible stuff. You can see some stuff on an MRI possibly, but it's all those other symptoms that people can't see. And I know that the good news is, as a society, at least we're starting to recognize more that these are real things, right? I think about chronic pain. I mean, we created a pain scale for that purpose, right? I mean, a pain scale is something telling the doctor how you feel. It has nothing to do with how the doctor thinks you feel, right? So, excellent information on it. Yeah, keeping a journal of everything you're going through. I think of my wife. She has a hardbound book for like the last 30 years almost of every year of everything that she goes through, right? Keep track for herself, and also helps her with her doctors too. So
Yeah, those are helpful. And then a new one, Wayne, is long COVID. That's something that's obviously
yeah,
relatively
yeah.
new, as we all know. But that's a lot of times those symptoms are invisible. You've got individuals who never were hospitalized but have chronic symptoms as a result of COVID. And keeping a journal and education, it helps that the ADA has recognized that as a disability. So it's kind of an education process for the judges and Social Security as we go along.
So how should you just talked about this, how they should prepare, right? So they're going to be filing a claim. You talked about creating a log. What else should they do to prepare for filing a claim?
Yeah, make sure that you're seeing your doctor on a regular basis. So again, Social Security needs to see that longitudinal record, and part of that obviously is having a longitudinal record. So, and the only way to do that is to see a doctor, and it has to be an acceptable medical source. And Social Security defines that as either an MD or a DO. The example that I use of somebody who's not an acceptable medical source would be like a chiropractor. Obviously, that's not necessarily relevant to people with invisible disabilities, but has to be an MD or a DO. Nurse practitioner is also an acceptable source, but see your doctor on a regular basis, and make sure that you're telling your doctor everything that you're experiencing so they can document that in the record. It's also Social Security disability is also about function. So it's not whether or not you have a diagnosis. That's not enough to get approved. They're looking at your ability to function and how that affects your ability to function on a daily basis, and ultimately how that affects your ability to work. So not only do you need to tell your doctors what you're experiencing in terms of your symptoms, but also your ability to function, so that the doctors can get that in the medical records. And also have a good relationship with your doctors. If you're unable to work due to your disability, make sure that you're talking to them about that, and about their support of your if you're wanting to file for Social Security disability, or if you think you need to file for Social Security disability, make sure you're talking to your doctor about that. Mentioned it already, but keeping a personal log of your symptoms, when you have a bad day, what those bad days look like. And also it comes down to not whether or not you can do something or can't do something. So you, in the process, Social Security will ask about activities of daily living, things like cooking, cleaning, washing dishes, things like that. And it's not really whether or not you can do that, but how your condition or how your disability impacts your ability to do that. So yes, don't just simply say, yes, I can wash the dishes, but it used to take me 5 minutes to wash the dishes. Now it takes me 2 hours to do it because I have to take breaks during the day, or how it affects the next day. Yes, I do this task. Yes, I went to the grocery store, but I was in bed the next day. Document that. Tell your doctors so that they can document it. In addition to that, third-party statements are always helpful. So if you're living with a spouse or someone else that can provide testimony on how your disability impacts your day-to-day living and your ability to function, those are very helpful in a disability claim as well.
Well, and I think about, obviously you talked about the ability to work. I mean, that's going to be wherever you were working, you're no longer able to work there. I mean, the reality is that's a big part of it. I mean, we always think that most people don't want to work, and we'll get to that in a sec because Diane's going to help us with some of those things. But people do like working. I mean, they like being productive. They like getting out there and do things. And so all I know is that SSDI is not the thing that people, you want to rush and get because it's not necessarily going to give you this flood of money that everybody thinks it is. Yeah. But the reality is it's money that you've earned through your working abilities, and it's going to help support you. And just real quick here, if you can tell me, and I know I'm saying real quick, the difference between SSDI and SSI real quick, because I know that's a confusion for people, and people, just brief explanation what the difference between the two is.
Yeah, very good question, Wayne. So there are two federal programs related to disability. One is SSI, as you mentioned. The other is SSDI. Start with SSI first. So oftentimes they're confused, as you mentioned, but they are two different programs. from a medical basis in determining whether or not somebody's disabled, it's the exact same criteria. The difference is SSI is a needs-based program. And so there is a means test in order to qualify for that. So it's individuals who don't have a work history, and also they're destitute, and they have very little in terms of income and resources. And so there are income and resource limits that they would have to meet in order to qualify for the SSI piece of that. The SSDI is funded through FICA taxes. And so a portion of your FICA taxes goes towards the disability program. And you have to be insured in order to qualify for that. A good, easy way to do that is have you worked 5 out of the last 10 years. If you've worked 5 out of the last 10 years, then likely you are insured for SSDI.
Well, that's great. Great news. And you know, we're just taking a cursory glance at this. There's a lot of this more we can learn about, and I really appreciate that. And you know, we'll give them the resources where they can get that more information, right? So I want to kind of move. Thanks, TJ. That was great. And I want to move on to Diane. So Diane, would you mind sharing about people receiving SSDI? So they've already got approved. They're on SSDI. You know, they've gone through the process. Maybe Allsup's helped them with that. You know, what if they really want to try to work, right? Maybe, you know, they became disabled or have a disability and it pushed them out of work, and maybe they want to try to see, hey, maybe I can work a little bit. You know, what does that look like? So tell us a little bit about that.
So thank you, Wayne. Great question. That's the Ticket to Work program. So the Ticket to Work program is a free and voluntary program from the Social Security Administration. It's for individuals between the ages of 18 and 64. And the whole goal of the program is to help these individuals get back to work and eventually no longer be reliant on that disability benefit. And unfortunately, the program is not very well known. Not a lot of people take advantage of this free and voluntary program where no cost associated. You have employment networks like Allsup Employment Services that can assist these individuals, and you also have State VR that can assist these individuals. But it's really through this program that an individual gets to test their ability to return to work. The nice part about the Ticket to Work program, they have 3 different phases of the program. The first phase is the trial work phase. And what's wonderful about the program is these powerful work incentives and protections that are built in. So the first phase of the program is an individual can attempt to return to work, and I like the word attempt or try to return to work. And it's if they work for 9 months, and it's not 9 consecutive months, it's 9 months over a 60-month period. So that gives them 5 years to test their ability to return to work. And then once they're successful in those trial work months, then they go into the second phase of the program, which is the EPE phase of the program, which provides the benefit of Medicare for 93 months. And anytime that their benefit drops below substantial gainful activity, which changes on an annual basis, but once it drops below, they're still eligible for their benefit. Their benefit is never terminated. It's just paused, and we can assist them in getting their benefit reinstated. And then after the EP is completed, then they have the EXR, expedited reinstatement. So should someone return to work, no longer be reliant upon the program, but say they stop working for the same or related condition, they can get their benefits reinstated without having to file a new disability claim.
Wow. Yeah, that's great. I mean, you know, like I said, people want to work. I mean, that's the whole point. We love getting out there, and it's tough when you're unable to do it because of a disability. In some cases, obviously, their disability may change, right? Because they're changing over time, and maybe it was more of an injury type of thing, and they're able to come back from it eventually. You know, we also know there's a lot of people that are chronically and they're not able to do this. And I think that the key for us, and I think about Allsup is that it's us not making a judgment on, well, you look like you can work, but you can, or you don't look like you can work, but you can, and all those things. It sounds like there's a whole process that works through that. And there's this fallback that says, hey, don't worry, we're not going to kick you off if for some reason you try to go back and it doesn't work out, right?
Right. Well, especially individuals who have invisible disabilities, right? They're not obvious. So there's lots of challenges trying to go back to work. The stigma, the reluctance to disclose the disability, fatigue. How am I going to manage the job demands when I have all this? Am I going to be viewed as less capable? So here at Allsup Employment Services, we help those individuals by self-advocacy skills, talking about accommodations, when to disclose that disability, when to ask for those accommodations. And individuals who work with us, they have the benefit of a vocational case manager. So they have a single point of contact that they can reach out to, who will assist them as they return to work and when they need to navigate once they're back at work.
Wow, that's amazing. Thank you so much, Diane, for that.
Mm-hmm.
Yeah, that's exciting news. I mean, it's, obviously getting help trying to get the disability, SSDI, and then being able to say, hey, maybe you want to try to work, or maybe you could do it. So that's a great, thank you. Thank you so much also for providing that service. That's awesome. Now I want to kind of talk to Brent. Let's talk a little bit about a different subject, which impacts our veterans, right? And this is something that was just totally surprising to me, right? I mean, we all think about, we hear about disabled veterans or the people that are actually, veterans that are discharged because of their disability, and there are different levels of disability. Is it 50%, 100%, all those kind of different strange things that they have that the military does a little bit different. But if you think about those, well, what happens if you are discharged and it's not for a medical disability? It's just your standard, you go in, you do your 7 years, and you get out. What happens from that? So Brett, tell us a little bit, how does an invisible disability impact a claim with a VA? And, what does this look like? I mean, what is an appeals and all that kind of stuff? If you can share a little bit more. It's kind of a little complicated, but I'd like to know. Thanks.
Sure. Yeah, no, thank you, Wayne. So one of the key differences between the VA program and what TJ was talking about with Social Security disability is that it's all about relationship to service. So going back to what you were saying, Wayne, you don't have to be discharged for a medical purpose in order to be eligible for the VA compensation program, or what almost everyone else, including myself, calls VA service-connected disability. The three main requirements is that the veteran needs to have a current disability today. There needs to be evidence that something happened to them in service. And then there has to be evidence that the two are medically related. And if you can fulfill all three of those, I call it three legs of a stool, then that stool will stand up and the claim will get granted. So when it comes to invisible disabilities,
They feel like they're invisible. Let me tell you, they feel it.
Yes. One of the biggest challenges that we see, especially for claims that are denied and come to us for the appeal process, is that the evidence that something happened to them on active duty is just as invisible. It's not that it doesn't exist, right, Wayne? But it's that it's frequently buried in non-standard documentation, or symptoms were misdiagnosed early on. A lot of these disabilities, such as mental health, or even disabilities related to exposure to environmental factors like chemicals, are event-based things. And those are just not documented all the time in that veteran's individual medical records or their personnel file. It's an event that happened to them, to their whole unit, that it didn't warrant individual documentation. So it's just the evidence itself is automatically already at a unique challenge for these types of claims. And then when you do establish service connection, that rating that you mentioned, the percentage, that's supposed to reflect how bad the condition is today. A veteran can work and still receive VA compensation, but the percentage, the rating, is supposed to reflect how severe it is today. So you can establish service connection for fibromyalgia due to your service over in the Gulf area. But however, if it's rated at 10%, that may not be truly reflective of that current severity. And that's where the invisible disabilities also pose a challenge of, kind of going back to TJ's point, is that functional limitation can be very difficult to capture in the current state. Testing can often confirm a diagnosis, but it's hard to measure that functional limitation. And so we struggle with that on the VA side as well.
No, wow, what great information. I'm sure veterans, this is a tough area for them, right? Because they're like, how do I go back? How do I get this help? How do I get the help I need? And I think this is something that's so missed, that they don't know that service is out there, right? And the ability and the fact that Allsup said, hey, this is really important. We want to focus on our service people as well and have an impact on them. I think that's amazing. One of the things I always think about on the whole issue of Social Security disability insurance, for example, SSDI, we always think, everybody's like, oh, isn't that the one where everybody just fraud and it's just a bunch of fraud and everybody's cheating the system and everything? And I always say, well, let's see. You have to traditionally not worked for a year in most cases. And then it takes 3 to 5 years to get it on probably an average. I'm hoping that's getting faster. And then in the end, you get $1,500 a month or something like that, just some amount that's like, it's really hard to live on. So not something you really, and you can't work, by the way, during that whole 3 to 5 plus the 1 year in a sense. So it's like, no, this is for people that really need it, who are really dealing with disabilities, who, have earned it. It's something where it's this extra little lifeline. And, I really appreciate what Allsup is doing. So I want to kind of bring in the panel here and kind of just, I'm just going to throw some questions out and anybody can grab the answer. That's fine. Kind of what's the most important suggestion you would offer to somebody with invisible disabilities needing to get approved for disability benefits? I mean, what's that one thing that and I think TJ's touched on some of these, but something that they could do better. Anybody?
Yeah. So
Yeah,
I'll jump
echo.
in. Go ahead, Brett.
Go for it, TJ.
Okay. So, yeah, number one, I would say seek a representative like Allsup to help navigate the process, because it is a hard process and frustrating process, and a representative like Allsup can help with that. But beyond that, it would be communicating with your doctors. Make sure you're seeing your doctor on a regular basis. Make sure they're documenting their records well. Yeah, that would be the most important piece, I would say.
Well, and I also think about if people that become and they get the disability, right, you have to keep it too, right? There's reviews,
Correct.
there's annual reviews and those type of things. And maybe your doctor doesn't have a cure for your illness, right? And maybe you got MS and there's just, maybe you can't take the medicines, whatever it is, there's no cure for it, but you still need to see a neurologist on a regular basis, right? And so that's one of the tough things is that, people with invisible disabilities get frustrated with their doctors and for a good reason, because they don't have an answer to anything sometimes. And so, but you need to keep doing that. So I really appreciate that part of, keeping it going. Somebody else have a comment on it? Brett, you had a comment you wanted to.
Yeah, no, I will just echo and definitely agree with TJ's suggestions. In the VA land, what I tell our veterans that we help is that try to educate yourself the best you can on these diseases and these conditions, because I need your help. You're the subject matter expert. You're the one who experienced it during active duty. Once you got off active duty, and like you said, Wayne, in your example, 7, 8, 9 years later, then all of a sudden the real disability really starts showing its head from a functional issue. One of my most rewarding claims that I love getting granted is multiple sclerosis, and the reason why I love getting them granted is because, one, it's a devastating disease, and so by the time the veteran's filing, the disease has really manifested to the point where it's really affecting them. But when you know about that disease, it often goes misdiagnosed for years, and it comes and goes with its symptoms. And when you look at their service records and you see the symptoms of MS in those service records, but they're not chalked up to be symptoms of MS at that time, and you find the right and you work with that claimant's doctor to say, hey, can you review this file? And knowing what you know now, can you connect these dots that, hey, that was probably MS back then, just no one knew. You don't have to say anything about it being related to service, anything. Was that MS? And the doctor often will say, yeah, no, absolutely. We know what the end answer is. So looking at the beginning, I could tell you that's probably what the beginning of that story is. And then when you bring that to the VA and it all starts clicking and making sense and it gets granted, it's very satisfying. So I only knew how to do that because I had to learn about how MS works and how it manifests. And so I asked the claimants to do that. And if you're filing, just try to get to know about your condition and because you're going to have to be able to explain it to others.
Well, you're right. I mean, they're the experts. I think about my wife Sherry, who it's been 33 years since she was diagnosed with MS and Lyme disease and those things. She is the expert. I mean, she'd have a PhD in this stuff, right? I mean, and that's exactly right. And doctors need to understand that as well. They need to understand that they get 15 minutes with a with a patient, and that patient actually knows very much more than they do about, especially their specific things. So another question I've got is about how can the caregiver really play a role in this? Because are they allowed to talk with you? Are they involved? Do they help? I mean, I'm sure there's a lot of paperwork, and a lot of times a person with a disability, it may be a cognitive issue, which is invisible. It may be other things that are going to impair them on trying to, this world all of a sudden seems like this big navigation thing. So anybody want to jump in? That would be great.
Yeah, very, very good question again, Wayne. So a couple of things. The narrative letters can be very helpful, especially with individuals with mental impairments that don't always fit in the record in the exam notes. Narrative letters can be helpful to give more detail on the functional limitations that individual is experiencing. We also have questionnaires that we can send to doctors that are geared towards specific conditions. So we can gear them towards symptoms or limitations that specific disability are common with that specific disability. So if doctors or caregivers are willing to help complete those, that's helpful. In terms of personal caregivers, again, like third party testimony, narrative letters, questionnaires, ADLs, how that individual is able to function on a daily basis are also helpful.
Awesome. That's great. How do you guys deal with this stigma? I think about, Diane, you're talking about going back to work, right? I mean, it's hard enough with invisible disability for people sometimes to even believe that you're dealing with anything. And then they're like, oh, they're back to work. I see they are making this whole thing up, right? And, how do you guys kind of help them through that, navigate that, right? Because that's kind of a big part of it.
So I can take that. Again, it's a good question. It might come up with accommodations, like when to disclose and asking for accommodations. And some of the common accommodations for individuals with invisible disabilities include flexible scheduling, task reminders, a quiet workplace, maybe modify the training for a new hire. And you said about like cognitive impairment. Say an individual may have a cognitive condition. So they may benefit from like written instructions alongside verbal instructions, but it's really having that conversation at the right time with the employer.
No, that's great. No, I appreciate that. Right. Because, that's the biggest thing. We talk about accommodations a lot here too, is that you got to let somebody know. HR needs to know, managers need to know about ADA stuff and those things. And so I think that, our vision statement is that people would be invisible no more. And what that really means is we just start treating everybody the same and understand that it's more common than uncommon, right? That we talk about, I think 57% of the people have chronic illness, and maybe even higher than that. 27% of adults have a disability, right? So it doesn't mean they're disabled by it. We really want to be distinctive about that. Talk about, what SSDI is really for somebody, what I would call who's disabled. They're unable to perform major life activities, including work, right? Is a big part of it. Versus having a disability is, an assistive device. And I mean, people run Ironman triathlons with a disability, right? So everybody who's disabled has a disability, but not everybody has a disability is disabled. And I really want to be clear about that definition too. So I'm kind of going to go ahead.
I was just going to add on the accommodations. So our approach here at Allsup Employment Services is really to frame those accommodations when asking for them regarding productivity. So it not only benefits the disabled individual with an invisible disability, but also the employer.
Well, that's interesting because that's actually an ADA requirement is the person has to be able to perform the job with the disability and the accommodation, right? So if you're not able to perform the job with an accommodation, then you're not able to perform the job. So absolutely. Well, I so appreciate all the amazing work that Allsup's doing. And I'm going to ask all of you each a final question here. And this is called the Invisible InCourage Show. And if you notice, it's spelled InCourage because we talk about what courage is, and it takes courage to get through the day. And so we just like to do this as kind of a little question at the end for each of you. And so I'm just going to go ahead and start. And TJ, I'm going to start with you and just say, what gives you courage to make it through today? Not the week or the month or the whole year, or how did you make it through COVID or whatever, but what's the one thing that gives you courage to make it through the day?
Oh, that's a good question, Wayne. So, I mean, ultimately, just what gives me courage just every day, which is your question, is my faith. My faith is very important to me. So that's what helps me get through each day.
That's awesome. Thank you so much. Diane, what gives you courage to make it through the day?
So I'm going to go a little different route. So I have relationships with many of the beneficiaries that we work with. They reach out to me directly. I'm not their case manager. I'm the director of the program, but I'm here to assist when needed. What gives me courage is when they go back to work. And they're like, I haven't worked in 15 years. And I'm a huge proponent that I think work is therapeutic, gets you out of the house, gets your socializing skills. So I love hearing those stories because I'll have individuals come back and say, hey, Diane, I'm still working, which is wonderful because that's what we're here. We're here to help them go back to work, retain that job, and then hopefully eventually become financially independent.
Wow. So you get encouraged both ways, right? I
Yes.
encouraged and E encouraged. That's awesome. So, Brett, tell me what gives you courage to make it through the day?
Yeah, no, it's a great question. I appreciate going last because it's allowed me to think about it a little bit. So, because it's a deep one. I love being able to kind of, to what Diane was saying, help people and to see that positive result come and make a substantial difference to that person's life. But to back that up, personally, I love solving puzzles. I use that MS case as a puzzle. And this job and helping veterans with their VA compensation appeals, every single one is a puzzle that needs to be solved. And I love it. And if you get to do something that you love that ultimately benefits people, then you got the best job in the world.
Well, and I appreciate your service because I know you're a veteran, and two, the fact that you're helping veterans, and those are people with incredible courage, right? What they do, and people with invisible disabilities have incredible courage each day to make it through the day. I like to say their Ironman triathlon is sometimes just getting up and able to get in and make a sandwich or do something, for the day. I mean, or that's their climbing their Mount Everest, right? So amazing opportunity, and the courage that they show. So I want everybody to know
Sorry, Wayne. I'd like to amend my answer now that I got a chance to think about it.
That's great. Go ahead.
But what encourages me, I mean, I would echo what Brett and Diane mentioned. It is very encouraging when you have somebody who you've been working with for 3 to 5 years, which sometimes it takes that long to get somebody approved SSDI, and being at the back end of it when you're at the hearing with the judge, and the judge says, I'm granting your case. That is very very encouraging. Had a long COVID case recently where that happened, working for 3 years on that case, and ultimately was able to get her benefits granted at the hearing. And that's it keeps you motivated, encourages you, and helps you want to come back the next day and do it again. So.
Well, I like to say that's visible courage, right? That they're going through. And so
Correct.
You guys ought to put up a wall there at work. It says, these are all of our amazing people with visible courage, right? My wife is the prime example of that. So I would want to say, just to, maybe invisible what she's going through, but it's just so visible, her courage. Absolutely. So everybody, let's learn more about SSDI. You can go to ida.allsup. That's ALLSUP.com. ida.allsup.com. You can check out the Allsup employmentservices.com for help and returning to work as an SSDI recipient. And for help with a VA appeal, go to allsupveteransappeals.com. You'll see these also on a slide, so we'll have that for you. Thank you again for joining us for another episode of the Invisible InCourage Show. Learn more about IDA at invisibledisabilities.org. You can also listen to more shows like this at IDA.FM, that's IDA.FM, or watch at IDA.TV. Have a great day and be encouraged.